Hey Keith, it's Donnie here. We're just getting started on the left shoulder. We're looking in from the back to the front. We examined your shoulder before we started and there wasn't any instability. This is the biceps tendon that's been chronically inflamed. And you can see it's torn a little bit inside the joint, but of course the main area of the inflammation is outside. But you can see even inside the joint, there's some evidence of some changes in the tendon. So we're going to release it here. Okay, now that's gone. And now we'll have a look around the rest of the shoulder. We'll put a shaver in the front. Your rotator cuff is right here, and the cuff looks great on this left shoulder. A little bit of a fraying right there. We'll take care of that. Posterior capsule looks good. I don't really see any significant arthritis. So this is, for the most part, good news inside the joint. And we're just using the shaver just to smooth out some of these areas here. Okay, so now we've smoothed out that area at the bottom of the shoulder. I don't see much else to do inside. We'll keep looking around, but other than some little fine-tuning, smoothing out some of these areas, I don't think there's much else to show you inside the joint. Pause, please. So we're up in the subacromial space. We've already taken off a little bit of a bone spur. Actually, it's a pretty good-sized bone spur. And now we're using this shaver just to identify the rotator cuff so we can take a good look at it here. Okay, so here's the front of the shoulder. The bone spur used to be right up here, and we've got that completely removed. This is a little bit of a ligament here that we can release. It's pretty thick in your shoulder, which is not unexpected given the size of the bone spur you had. So that's now released. Okay, and that looks good. And as we look down at the rotator cuff down below here, we can rotate the shoulder, and the cuff is below my instrument there. And this is all normal cuff. So we're going to finish up with the arthroscopic portion of the procedure and get to work on reconnecting that biceps tendon. So this will actually be the end of the videotape since the rest of what we're doing is not arthroscopic. So good luck to you now. Bye-bye.